Healthbreak is sponsored by Mission Health.
When shoulder pain begins to interfere with your life and medications, injections, and physical therapy aren't effective, shoulder replacement surgery may be an option. Shoulder specialist Dr. Gordon Groh says most people are surprised by the details.
Shoulder replacement can be done 90% of the time as an outpatient surgery. It's a minimally invasive procedure. It's an incision that's just over about 2 inches in length.
Most patients don't need a big sling after the surgery.
The amount of downtime is really minimal because shoulder replacement surgery is about bone healing, which is really about twice as fast as tendon healing. Well done shoulder replacement makes your pain go away. Well done shoulder replacement makes your function so much better. If you're someone who's interested in playing pickleball again, if you're interested in getting back on the golf course, our office will hand you a program that takes you from playing no golf to playing 18 holes.
To learn more, go to missionhealth.org/healthbreak.